Community Mental Health Board, Community Health Network. So I'm going to call this meeting to order. This is the September 21st board meeting. At this point, we have moved from our main room to the Superior room. So we don't have flags, so I think I'm going to just forego the Pledge of Allegiance because we don't have a flag to lead to take a pledge to. And we'll go right into roll call.
Ms. Bernard?
Here in Oakland County, Michigan.
Mr. Cowan?
Here in Mackinac County, Michigan.
Mr. Furman?
Present virtually in Troy, Michigan.
Dr. Guadalupe? Dr. Hans?
Present in Bloomfield Township, Michigan.
Ms. Mamie Dyer? Ms. Root? Here. Dr. Todd?
Here.
Mr. Torres?
Here, Ann Arbor, Michigan.
Mr. Lanson?
Here at our headquarters.
Ms. Newman?
Here in Pontiac, Michigan.
Okay.
Sorry, Mr. Lanson.
All right, next up is the public comment. Is there anyone who wishes to make public comment at this time?
We have no public comment in
No one's registered?
the form. We do have a second opportunity at the end of the meeting for public comment.
Okay. Next item on the agenda is Stories That Inspire Hope. Tonight is with Progressive Lifestyles. They are a specialized residential team that helps us out, helps the people we serve. So with that, I'm going to turn control over to Jennifer Vaughn, Catherine Simpson, and Alicia Young. And thank you, welcome.
Hi. Hi there.
Hello.
We're so excited to be joining you all today. You can go ahead and go to the next slide. Thank you. I'll just do a super brief introduction. I'm Jennifer Boney. I'm the Executive Director and CEO of Progressive Lifestyle. I also have with me our friend Alicia Young, who's going to be sharing some of her experiences that we're really excited about. And then, of course, our Operations Director, Catherine Simpson. I just want to brag on Catherine for just a half a second. She's been with Progressive Lifestyles for 30 years, I think, at this point, right, Catherine? And she's absolutely instrumental. She has deep knowledge in all of our operations, our functioning, licensing requirements, and is incredibly skilled in general teaching. So we couldn't be luckier to have Catherine on the team. You can go ahead and go to the next slide. Thanks. So I'll touch just really quickly on our mission and vision, and you're welcome to read that on the slide there. The gist of our mission is that we're here to try to provide the best possible environment for the people that we support to reach their personal goals, to make progress in the areas that are important to them. So we do all of that by really doubling down and digging into our principles of gentle teaching and really trying to create a true culture of gentleness for the people that we serve and for our staff. We think that you have to hit both. We have to treat our staff with just as much kindness and gentleness as we do the people that we support. So we do that by focusing on creating a safe environment and making sure that the individuals we serve and our staff feel valued. We maximize praise. We limit demands whenever we can. We maintain a consistent structure, and we try really hard to reduce stress during transitions. So, and whenever the going gets tough for us, that's where we go back to. We say, how is our structure? How are the relationships? And we focus on those things. So I think that is something that we believe in very strongly, and it's one of our core values. So that's our mission statement. That's the work we're trying to do in the world here. Our vision, we just really believe that there's a place in our community for everyone. So the people that we support and our staff, who sometimes are marginalized, unfortunately, we really believe that community inclusion and acceptance and belonging are possible and they're essential. And so we have to work really hard to make sure that happens. So that's kind of our vision for the future. You can go ahead and go to the next slide for us. Thanks.
I would like to introduce my friend Alicia. I'm so incredibly proud of Alicia. She's lived in progressive lifestyles at a specialized residential home, Lock Haven, since 2013. And as of tomorrow, she is moving into her very own private residence that Progressive Lifestyles supports with a couple roommates. I'm super excited for her. And she has a few words she would like to say.
Hi, my name is Alicia. I'd like to sing, go bowling, joke with my friends, go out for ice cream, do arts projects, and play on my tablet. Visit with family and friends.
Next slide, please.
I am so excited about to move to my new house. I am really for more independent in my own house with housemates.
I think you're excited for a cat too.
Yeah,
Right.
I feel great about getting healthy, lost 20 pounds, and I am so proud of my hard work.
We're so proud of you too.
Yeah, absolutely.
COVID has been hard, but I am happy about all the time I got to spend together closely with my housemates and getting closer with fun activities.
Thank
so
you.
much, Alicia.
So Progressive Lifestyles currently has 107 individuals living in the homes, and we only have 2 vacancies as of right now. We have 166 staff, and we really should be at 220 if all the vacant caregiving positions were filled. Next slide, please. Oh, okay. We have 28 small 1 to 6 bed residential programs in Oakland County. 14 are licensed adult foster care programs and 14 are private residents that provides the 24-hour staffing. The service and organizational strategies are grounded and committed to create and sustain the culture of gentleness, as Jennifer was stating, with the feeling safe and valued, positive interaction, lowering the demands, the praise and structure, or the transition and structure. So without that, it's definitely what we need.
Yeah, for sure. Thank you. So we had the super. All of us are vaccinated. So when I'm talking, I'm just going to take this off. Sorry. So I think it was probably February of 2020. We had this super. We were doing some quality of life evaluations, and we determined that the biggest areas that we needed to address were around basically getting our folks out, getting them moving, and getting them connected to each other and to their families. So our engagement at that point, we had big plans, right? We were going to organize classes. We were going to partner with community organizations and get our folks out there enrolled. We were going to have all kinds of in-person activities going on, and we were so excited about it. And then, March and April of 2020 happened, and things got pretty rough with COVID. So we had to really reevaluate. We still believe that we have to get out, get moving, and get connected, but we had to look at lots of different ways to do that. So I'll talk a little bit more about what COVID looked like for us. If you want to go ahead and go to the next slide, and I'll talk about it later. Right now, just for background, we serve homes all over Oakland County, and as Catherine said, we've got 28 at the moment. You can go ahead and go to the next. Thank you. Catch up on mine. So COVID-19, and so we adapt. We had to figure out how to get our folks together, how to make sure that everybody was safe. And so that meant that some of our operations had to change. So one of the pieces that became sort of immediately an issue was that we were so incredibly short-staffed, but we were getting a few new staff on. They needed to be certified to give medications. And the med demos, where the staff demonstrated their competency to a morgue nurse, couldn't happen because we weren't seeing anybody in person. So we partnered with Morgue to be one of the first companies to pilot their virtual med demos. Our training supervisor was instrumental in that effort and helping to figure out what works and what doesn't. So you'll see there on the screen, we have some pictures of the setup in our office where staff come in to get certified. And I can't read it terribly well, and you probably can't either, but you'll see there's a sign in front of that caregiver on the wall, and I think it says something like breathe. Everything's going to be okay. So just to remind them, you're going to be fine. You can do this. You can go ahead and go to the next slide. One of the other big challenges was staying engaged at home. Getting out for a little while there was not really something that was easy to do. So we hosted virtual family visits. We paired people up as pen pals to send pictures and notes and make phone calls to each other. We planted flowers. We baked. We did arts and crafts. We played online games. One of our homes, a couple of our homes actually, continued to do the work they had been doing with Meals on Wheels. So they created, they would put meals together, and then they would go and do contactless deliveries out to needy folks in the community who might have been food insecure. So it just seemed like it really helped for folks to feel like they were getting to do something. I know many of you, and maybe me too, we all had that feeling, what can I do? And so I think it added a lot for our folks to be able to participate in that as well. You can go ahead and go to the next slide. Thank you. And sometimes we had to create new activities. So one of our homes, this is a picture of one of our homes that has a nature trail nearby, and they started going on hikes. And it's a lovely opportunity to get that mask off and get some fresh air and get some exercise, and really consistent with our get out and get moving piece of our priorities for quality of life. So we feel really good about that, and a lot of visits to the park, lots of walks around the neighborhood, and just a lot of outdoor activities like many of you probably experienced as well. You can go to the next slide. We would never have made it through COVID-19 without our community partners. So you'll see some familiar names, I'm sure, there on the list. And this is only a fraction of the community support that we've received. But just to give you a few highlights, Little Caesars gave, donated food. Honey Baked Ham gave meals to all of our homes on one occasion. It was just amazing and really brightened their spirits. You'll see, of course, Oakland Community Health Network is on that list. And I'm grateful for the opportunity to come before the board and just truly thank you. I remember a moment very early in the pandemic. I think we had several homes in quarantine. We had people in the hospital on ventilators, and we were still very much trying to figure out what the situation was going to look like and how on earth were we going to staff these homes where there was somebody that had COVID-19 inside. Luckily, we had shopped early and we had protective gear, so that was handled for us, even though, waiting for it to show up was pretty scary in those couple of weeks beforehand, but it was here in time. So I remember very early on, I sent an email over to the team at OCHN, and I said, we've got all these homes in quarantine. I have to get them staffed. I don't know what I'm going to do. And Anya called me, and she, we just had a very lovely conversation where she reassured me that OCHN was going to help us. They were going to make sure that we had the funding that we needed to provide appropriate pay for the staff. And that I think she said, I don't want you to worry about money right now. Sorry. I just want you to focus on taking care of the people that we serve. And I want you to know that was a moment that meant a lot to me. Sorry. You can go to the next slide. We'll get back where I'm comfortable talking about operational strategy. So when something like this happens, you've got to pivot, you've got to adapt, and we had to make up the rules as we went along and figure out, based on CDC recommendations and all of those things, how are we possibly going to get everything done that needs to be done to keep everybody safe. So we responded to COVID-19 by doubling down on our core values. So we said, what about structure? What about safety? How can we make the team feel safe here? And so we created an operational KPI dashboard where we could, at a glance, see how we were doing in various areas, including testing and case numbers. So that really helped us out. And then also staffing, how are we doing compared to our targets? And then we also created a COVID-19 outbreak management tracker. So that it's a tool that leads the staff, whomever is basically, we end up calling it like the outbreak commander, but whoever's managing a particular outbreak has this checklist to go through, and it walks them through the entire process of figuring out who's symptomatic, who's been exposed, have they been tested, what is our plan for testing them, what were the test results, based on the results, how are we quarantining if that's necessary, have we notified all the appropriate parties about the situation, and then when is quarantine lifted. So we walk through the entire situation, and then we also assess the significance of the exposure to determine what kind of quarantine is needed. And then we update all of these whenever new CDC recommendations come out. So it's a lot to manage, but we have really found that providing that structure for the team helped us to feel a lot safer when we were trying to manage an outbreak. So again, when the going gets tough, we dig into our core values. I think maybe that is all we've got, except for questions.
All right. Is there anyone who's virtual on the board that has some questions?
I don't have a question. I do have a comment. First, I'd like to congratulate Alicia on her new journey into being independent. Congratulations, Alicia. I'm sure your life will never be the same when you move into your new house with your new housemates. And that was it. I'm amazed at when we hear presentations like this, and then I go to meetings at the state level, and they're forever talking about how our system is broken. Because we have a lot of good people that are doing a lot of good programs for people. Yes, we need to change some things, but your presentation really should be recorded and shown in Lansing, including Alicia's testimony of how she's becoming independent and how you were able to make the pivot to take care of the people that you serve and your staff during this time that was so chaotic and so uncertain and so fearful. So I'm so grateful to you. And when you broke down and started crying, there was a wrap on my end. People know it doesn't take much to push me over the edge. But I just want to congratulate you and your staff for the outreach you're doing. And I wish you so much future. Thank you so much.
Thank you, Malkia. I see, Hadash, you have your hand up.
Yeah, I also want to say congratulations. It was such a great story. Congratulations to Alicia, and thank you to Jennifer. It really was wonderful to hear from you and hear how you pivoted, and it just was really beautiful. So thank you for presenting.
Thank you for having us.
Thank you. Vijaya, you have your hand up.
Yes, I also want to congratulate Alicia on her new journey and this next exciting step that she's about to take. And I wish all the best and success in that. My question for Jennifer is, what is your budget and what are your funding sources? Thank you.
I'm so sorry. I don't know if my audio is not so great. I didn't catch the question. I'm going to turn it up. Could I have that one more time?
Yeah. What is your budget and what are your funding sources?
Yes. I believe that this year we're going to end up around maybe 11 million, probably 12 million. A more typical year in the past would have looked more like 8 or 9, but with the additional funding that's being provided for staffing wages, that increases it a bit for us, significantly for us. And then we're running, as Catherine mentioned, we're incredibly down-staffed. So we're running a 35% overtime typically, which is just incredibly expensive. So that's typical for us nowadays, unfortunately. And then what was the second part? Sorry.
Your funding sources.
Oh, thank you. We're primarily funded by OCHN. Approximately 92% of our funding is from OCHN, and then we also have a few folks that we serve from Macomb and Livingston counties that were placed with us due to difficulty finding them appropriate placements in those counties. So they're with us now and doing wonderfully. And those are all of our funding sources.
Okay, so these residents from Livingston and Macomb County, they reside in Oakland County, or you have homes in those counties?
That is correct. They reside in our homes in Oakland County. We only operate homes in Oakland County currently.
Okay, thank you.
Thank you. Are there any other board members with their hands up remotely? I know, not seeing you, I'll turn to the inside. Christina or Steve? No?
Sure.
No?
Can we just talk?
Sure.
Mr. Furlan has his hand.
Oh. Okay. Adam will come back to you as soon as Christine.
Okay.
Okay.
I just want to say thank you, Alicia. Congratulations on this new path you're starting. Thanks for sharing your story with us. And thank you so much, Catherine and Jennifer. I'm sorry for all the challenges this past year and a half has brought you, but it's really, really encouraging and inspiring to see how dedicated you have been to the community. So thank you so much for sharing this with us.
Oh, you're very
Thank
welcome.
you.
Okay.
I just wanted to say again, congratulations to Alicia, and I know that Progressive has always been at the vanguard of culture of gentleness, and it really shows through not only in the presentation, but the care for the individuals they serve. So keep up the great work.
Thank you.
Thanks, Adam. That means the world to us. And as I mentioned a couple of times, I just know that that's what got us through this. Whenever things got tough and we started to wonder, what are we going to do? How are we possibly going to keep a terrified workforce coming in every day and giving what they need to give to the people that we're supporting? And it all came down to those principles. We had to lift them up so that they could lift the people that we serve. And we had to provide structure for them in order for them to feel safe. And so every time things get hard, we always go right back to that. And we say, okay, what are we doing around that structure? What are we doing around those positive interactions? Did we place too many demands on the staff all at once by changing operations and changing procedures to stay compliant? So that was really hard. We had to put a lot of demands on the team. And the community in the pandemic was already putting on more demands than any person should ever have to deal with for those folks. And we had to say, hey, this procedure is different now. And also you have to do all of those important things that you were doing using every bit of patience you have, every bit of positive attitude you have, all the knowledge that you've got in your head. And you have to do it all in full protective gear with an N95 mask. And you have to do that for 14 days. And also you can't see your family because you've been exposed to COVID. And maybe if there's something we haven't said enough, at least in this presentation, is that our staff stepped up and they did that work. And they said, okay, we're on it. We're here, and we know that if we don't do this work, nobody else will. So here we are, and they kept on showing up. And so we're at, like I said, we're at 35% overtime because we're so incredibly understaffed. But we found out what people were made of. We really did, and I couldn't have been more impressed by the team and what they were willing to do. So not to drone on too long. I could talk about how amazing our team is all evening. So I won't put you through that. But we really appreciate your invitation to come and share.
All right. Well, we appreciate you guys coming to do that. Alicia, I just want to take a moment and say thank you. This is Jonathan, our chair. I just want to take a moment and say thank you for sharing your story, your self-determination, risk-taking, to paraphrase Star Trek, to boldly go somewhere where you've not necessarily gone before. So that's a pretty amazing thing to do that. And Jennifer Bonet, just a thank you to you and your team and the personal sacrifice that they've made in having to do that. Not just, having to serve the folks we have that we serve, but also in having to give up spending time with their families if they're going into isolation. So again, thank you guys. Appreciate it.
Thank you.
Have a good evening. Um, Next on our agenda is the SUD strategic plan update. And I think, Christina, you're doing the briefing, correct?
I am. Thank you very much. Thank you very much for having me present tonight and give you an update on our 3-year plan. So tonight we're going to focus on our FY21 goals and what we've accomplished. Next slide, please. So we are going to start with prevention because they do have us break into prevention and treatment timelines, with the exception of this first goal, as I'll talk about both prevention and treatment. One of the goals, or the main goal that applied to both, was continuing all of our opiate-related grant projects. That's the State Opiate Response Grant 1 and State Opiate Response Grant 2. With that, we developed a lot of programming, essentially during a global pandemic, which brought with it a lot of challenges as we really had to help our providers shift from community-based face-to-face services to largely virtual services. And especially with prevention's very much used to being in the community. And so the grants went really well. I was especially shocked. For example, our prevention programming within local boys and girls clubs, that was a back and forth. I will tell you very much, because they were closing, then they were open, and we were able to deliver through our provider network the evidence-based prevention program called Life Skills Training. And then a couple other examples, transportation and medication-assisted treatment, jail-based medication-assisted treatment. We do community Narcan trainings and distribution for overdose reversals. We do another program called Prime for Life, which is an evidence-based prevention program. We have our employment services, which is the individualized placement and support services. So a lot of programs that we developed during this time, and I'm happy to say are working quite successfully. The other thing that was very important is that the prevention funds come from federal funds through the Substance Abuse Mental Health Services Administration, or SAMHSA. And one of the things that requires is that we have to conduct a needs assessment and use a special needs assessment type, which was developed through SAMHSA, called the Strategic Prevention Framework. That needs assessment requires a consultant to review all of the data and work with our community stakeholders and OCHN to lead us through the assessment. And so we had an RFP for that. That was another prevention goal. And the Michigan Public Health Institute was selected to facilitate. Another goal was that the needs assessment is facilitated, and we develop priority issues for Oakland County to be addressed throughout the next 3 to 5 years until the next needs assessment. Through that RFP and then our needs assessment process, the priority issues for the next 3 to 5 years are stimulant use. We never really had much stimulant use, especially methamphetamines, in Oakland County. There's a nationwide increase. We had so little admissions for it, it didn't really register. It did go to about 2%, 3%. That is statistically significant when you really have zero. And so it's important that we address that over the next 3 to 5 years. We want to prevent that from increasing. Also, accidental overdose. Our prevention programming focusing on co-occurring disorders, adult binge drinking, underage drinking, and then we have to, regardless of the needs assessment, but every region will tell you this, underage smoking and use of nicotine products, especially the electronic nicotine devices such as vaping. It is large within our adolescent population and something that we have to work to prevent from continuing to occur. Next slide, please. The other thing is, once you do the needs assessment, then you conduct your next prevention RFP according to the federal procurement rules, especially when funds are received from SAMHSA. You have to do an RFP every 3 to 5 years. And so the needs assessment really goes before the next RFP cycle. So we did conduct our prevention RFP this late summer. We're in the final stages of selection and notifying providers. That is very exciting to address from a prevention perspective those priority issues. And then the last couple of things, because we had to really focus during COVID on helping our providers be successful and continue to deliver services, we're still in process with our last two. And that is creating a provider survey and data tool so we can continue to gather additional countywide data that's well within the works and will be completely implemented in FY22. And then also an additional survey to assess provider success. And so we have tweaked our audit tool and we're working really closely with providers to best determine the best way to gather continued outcomes. Next slide, please. Before I transition to our treatment goals for FY21, are there any questions regarding prevention?
I see Adam's hand up. Adam?
I'm sorry. I'm sorry, my hand was up from previously.
Okay.
I see Malkaya's hand. Malkaya?
Thank you, Christina. One of the questions that I had was about the interventions that we use for underage smoking, especially vaping. Could you elaborate a little bit more about what we do to try to combat that? Because they make it look so glamorous to kids.
I know.
What do we do to overcome it?
That is so true. Well, right now, and for the first time, I actually wasn't involved in the RFP process, so I haven't yet been able to see all of the new programming that's been offered by the providers. But one of the things that has been done in particular is Michigan Department of Health and Human Services, their tobacco section, created a train the trainer to prepare providers and PIHPs for delivering educational messages and programming on the dangers of electronic nicotine devices. And so our prevention coordinator was trained, as well as many of our providers. And so they have that approach given to them by MDHHS that they will be using in their community forums when they meet with children, etc. And then I'm excited myself to see the proposed programming that was in each of the RFPs for the selected providers. So I can give you an update on that as we roll that out. Mm-hmm.
That'd be great. Thank you, Christina.
No problem.
Hadass? Hadass, you have your hand up, maybe on mute.
Hi, thank you. I'm wondering, out of all the providers that we have, how many of them do we work with for prevention? I don't think it's everyone. If you have an idea of how many there are.
Absolutely. We have 8 prevention providers that are scattered all throughout Oakland County. But among that is our largest prevention provider, which is the Alliance of Coalitions for Healthy Communities. And they're an organization that also oversees the 22 community coalitions that are specific to the cities and villages and townships that they oversee. And so they're an extension of our prevention providers as well, because we fully fund their services and we fully fund the Alliance to deliver those services for us. And so we really have about 30 different providers throughout the community conducting our work on our behalf.
Thank you.
Mm-hmm.
Anyone here? Okay. Christine, I have a couple questions for you.
Yes.
You were talking about grants, and I was wondering which of those grant programs have we converted from pilot to essentially part of our long-term budget?
No, we're still in the grant cycles, so we still are receiving the funding. But one of the things that I like to do when we apply for grant funds is apply for programming that we intend on sustaining. And so, for example, our jail-based medication-assisted treatment program, we were already in the plans to implement that program utilizing our current and existing funds. When the grant funds came up, we decided to apply for it and received it. Transportation was also something that we felt very strongly about and were intending on implementing as well, and as well as Narcan distribution. Things like life skills and Prime for Life, those are traditional prevention programming that can continue under our regular prevention funding when it's over. And a couple of the programs were programs that the MDHHS asked us to deliver. And so we hadn't planned on the programs because we were asked to implement them. And that was our individualized placement and support. And we have worked within OCHN. We believe in that individuals with substance use disorders have many issues with employment, and we have continued that. So that piece of the grant did end, and we are sustaining that and combining the position to assist both people with mental health issues and people with substance use disorder issues, funding them with both pots of money.
Okay, so at least one program is converting for long-term. That's
yes.
Great.
The JLMAT program will continue. We intend on transportation continuing, Narcan distribution continuing, and life skills and Prime for Life as well.
Well, I love the idea of the long-term view. The other is, and Kaya mentioned it briefly, was so underage smoking. And I know we're coming into October, and I think, isn't there always the survey of hitting the party stores to see who will sell cigarettes to underage? I know in the past it's just been cigarettes. Have they expanded that to the electronic, the vaping yet?
Yep, the electronic nicotine devices, they did. In fact, they did starting in fiscal year 21. That was, I will say, that was our largest challenge to date because they also increased the age to 21. And so while we had some challenges, the beauty of it is that everyone had challenges, and the government really gave a pass to states on that. And so where we have to achieve a 20% no sell rate, so 80% of store owners that sell nicotine products card a person, refuse to sell to people underage. That requirement was waived for this year because states had just a really difficult time during the pandemic, and especially in Michigan with the increase in age as well. And so we were given a pass. We, for the first time ever, we're just shy of the 80%. We're usually in the high 90s, and it is truly the pandemic that impacted it. It was a devastating blow for us because we're not used to it. We're used to really doing very, very well, but we know that there were challenges, and we know why the challenges were there.
Well, thank you very much for presenting. And oh wait, there's still the other half.
Yep, just a couple more slides, and I'll go very quickly. Thank you. If you could go to the next slide, please. So talking about our treatment timeline for fiscal year 21, we really wanted to focus on improving our analysis of data specific to substance use disorders, so we can better track trends. That's one of the ways, we're really looking at stimulant use, looking at program effectiveness, quality assurance, etc. We have completed this. All of our data has been transferred and created into Power BI dashboards. And so we meet regularly at minimum once a month to go over all of our data and see, what trends we are seeing, where we need to focus programming, and also monitoring in terms of monitoring our providers and their effectiveness. And so that's gone very well. One of the things that Michigan Department of Health and Human Services really wanted PIHPs to do is to really expand their withdrawal management, or what used to be called detox. And really expand it to to outpatient services. And so that's called actually ambulatory withdrawal management. And so most withdrawal management, if not all in the state of Michigan, really is at the residential level. And our goal for fiscal year 21 was to create and be able to pilot withdrawal management services. We are in our final stages of that, developing the benefit packages, and it'll all be completed and services will be ready as of September 30th. So we're coming in right at the deadline, and we're very excited to offer that as an additional service. Sometimes people can't leave and receive services in a residential setting. Sometimes that's not the most appropriate for them. Sometimes, especially in the midst of a global pandemic, people may not be well, but still require and need the service. And being able to provide these services on an outpatient basis will really expand our capacity and meet needs. And so that will be all set. We needed and wanted to very much so expand medication-assisted treatment capacity. That is completed, and Therapeutics, who actually was a presenter most recently for the Stories That Inspire Hope, they've expanded their Walled Lake location. They can accept many more individuals, and so that's a nice piece for that end of the county. We did not have services to that magnitude in that area of the county, as well as they are in the final stages and will be opening in the next week our new site in Pontiac. So we looked at our heat maps, we looked at where the needs were, and they did as well, and they chose Pontiac as a location to best meet the needs. They're actually being co-located with Easter Seals on Baldwin, and we are very excited about that. The providers have to go through numerous reviews in order to be approved to be a medication-assisted treatment provider, and that includes the federal government, state government, licensing, etc. And they have successfully met all of that, and we are very excited for them to open. Expanding capacity for adolescent withdrawal management and residential. That continues to be in process. There are not a lot of adolescent residential treatment providers in the state of Michigan. And our staff have been visiting those programs. And we have not yet, with the exception of one, found a program that really fits in line with our mission, vision, and values. And that is very important to us. Fortunately, very few adolescents rise to the level and need of residential placement, and the majority, if they have higher level of care needs, are intensive outpatient programming, of which we have plenty of that and are able to place individuals. We did do an RFP in fiscal year, I want to say 2020, before the pandemic. We did not have any bidders for that. And so what we've done, because we need to ensure that if there is a need for adolescent residential treatment, that we have a relationship with a provider. We have visited Wedgwood, and we are working with Wedgwood Services. They provide an excellent substance use treatment program. They are more in the Grand Rapids area, which is why we tend to like to see if we can find providers a bit closer to people's homes. But we are able to engage in single case agreements anytime that we need that. Next slide, please. We looked at researching the ability to implement a safe syringe program. There are some hot spots in Oakland County. They don't usually disclose those for good reason at the state level, but other than with the health department. But there are some hot spots in Oakland County where there's a higher prevalence of communicable diseases like hepatitis, HIV, or AIDS. And they can link some of this with injecting drug use. And so safe syringe programs have really been proven to work really well, and also providing the education about treatment and referrals to treatment. And we are really excited to say that we partnered with the Oakland County Health Division. They received some funding to implement a safe syringe program. We are also providing some funding for that as well. And they also have a recovery coach that that works with them. And so they provide a great deal of education as well, and referrals to treatment when individuals visit them. They are a mobile unit, and so they travel to different places in Oakland County as different municipalities allow them in. And I'm happy to say it's going very, very well, and we are very excited about that program. We had hoped to attain the cooperation of at least one hospital for Project Assert. I know I've mentioned this before. I have now enlisted Dana Lassenby and Kim Flowers' assistance on this. And so Dana has sent letters and reached out to CEOs of the hospitals. I do have to grant the hospitals some grace. We were in the midst of a global pandemic, and they really haven't been able to allow a lot of extra people in the emergency rooms. So that's been one of our largest challenges with that. We are still working on it, and we hope to be in all of the emergency rooms that will take us within the next 2 years. We want to focus on two specifically that seem to really see the majority of individuals that we serve with substance use disorders. We will start with those two hospitals, and then we will move on. So we are very thankful. I'm very thankful to Ms. Lassenby and Ms. Flowers for their assistance and what they will do to continue to assist us with that. Establishing outcome-based contracting to improve people's ability to attain or sustain recovery. We began our residential service model in May of 2021, and so that's the launching of our very first service model, and we are well into working on our next service model, which will be medication-assisted treatment. So we're very excited that we completed that goal for residential treatment and that we are moving forward. And then we were researching the ability to pilot jail-based programming for the treatment of alcohol use disorders. There are hundreds of cases pertaining to alcohol use that hit the jail every year. And so we really wanted to see what, if anything, can we do to assist people that come in. Vivitrol is a medication that can be used to treat alcohol use disorders as well as opiate use disorders. And what our research found was that many people are released from jail very quickly with alcohol use disorders. However, of those that stay, what they're really looking for are behavioral health services. So I'm really excited to say that our liaison in the jail, Melissa Gregorio, of those, about 40% of individuals, 60% are booked out very quickly within 24 hours. About 40% remain anywhere from 3 days to longer. And of those 40%, 73% really wanted continued services. And then after that, 88% wanted discharge services as well. So we know it's really the behavioral health, the supported support services, and then connection to treatment is really what is needed, more so than the medication, because we can connect them to that in the community. If we see a need, we will add that piece. But one thing we are really happy to have implemented was the support services in the jail. Next slide. Increasing diversity, equity, and inclusion efforts. We are well underway with that. I know Tricia Zizumbo, our Director of Training, has talked a great deal about our DEI efforts, and we are heavily involved in that. I'm heavily involved in that personally, as well as our providers will be involved and are involved in that as well. One of the other things that we are doing is partnering with Oakland Family Services to address racial disparities. The Michigan Department of Health and Human Services reached out to substance use directors across the state, letting us know that the Michigan Health Endowment Fund would be sending a notification of grants to community partners, and that they wanted us to partner with them. Oakland Family Services received the grant, and we are working very closely with them. This first portion of the grant is to identify the purpose and reason for these racial disparities. Largely, this is focusing on referrals coming out of hospitals. There is a significant disparity as it relates to individuals receiving referrals. Individuals of color are receiving referrals to treatment services at far less rates as individuals that are of Caucasian descent. And that is a major problem. And so we are all too happy to be heavily involved in this grant process, determine where the needs are, and see what we can do. I have no doubt this will assist us in working on Project Assert, and if we have our peer recovery coaches in the hospitals, we can decrease those racial disparities significantly. One of the things that we needed to put on hold was our outpatient treatment RFP. There was a lot of RFPs that needed to go out this year, and priority scheduling required the contracts and procurement team to postpone that. That will be okay. We will continue to amend the contracts to continue our outpatient treatment contracts, and we will be looking towards having an RFP for treatment service for outpatient treatment services within the next fiscal year. And then it was to continue to monitor that data pertaining to stimulant use, especially methamphetamines. And we're continuing our research, and we're looking at specialized programming. There is one specialized evidence-based program that is indicated for both opiate use disorders and stimulant use disorders, and that is a program called contingency management. And so we have researched the training for that for providers. We've worked with Tricia Zizombo on bringing in the trainer for that, and it is our intention to bring that trainer in FY22 so our providers can start implementing that program where we see the highest need. Next slide. And that is it. If there are any questions related to treatment, I am happy to entertain them.
I'm looking to see if there's any virtual that is doing that in the meantime. Anyone local? No. All right. Melkaya.
Thank you, Mr. Lansman. I just had a couple follow-up questions. With the medical assistant treatment for substance use disorders, I know in the past there's been a lot of resistance from judges not really understanding it. Are you seeing any more acceptance at their level? And what are we doing to try to educate them and around that?
That's an excellent question, and I am really happy to report that there has been major shifts in thinking related to medication-assisted treatment. We will always have some individuals that just can't get behind it, but I would say by and large, across the state of Michigan, judges have really grabbed onto it and understood, and a lot of that's had to do with a lot of education we've provided. I was a few years ago, I was appointed by the legislature to the State Drug Treatment Court Advisory Committee. And so I sit on that, and there's many judges, law enforcement, et cetera, from all around the state. And so part of what I've done is educate further on that, but also I've seen the transformation because really almost all regions are represented on that advisory committee. And so it's really made a major change and shift over, I would say, the last 3 years.
That's wonderful, because people have a life when they have the medical assisted treatment. So that's wonderful. And just to follow up on Project Assert, I remember you bringing it to us before, but that's the program to have the peer recovery coaches placed in the ERs?
Yes.
Okay. All right. Thank you.
You're welcome.
I'm not seeing any other hands.
Sorry. Great presentation, by the way. Thank you.
Thank you.
Christina, thank you for presenting. Thank you for bringing us an update on the SUD, Substance Use Strategic Plan.
Thank you.
And I look for more.
Thank you very much.
All right. Next on the agenda are the committee reports. I'll start with my executive board. committee, we met hybrid September 1st. It's our usual first Wednesday of the month noon meeting. It was attended by our vice chair and chair of policy committee, Dr. Sarah Guadalupe, our secretary, Adam Furman, and our chair of business operations committees, Eric Lindemeyer. Also attending was our CEO, Dana Lazenby, and our chief legal officer, our legal beagle, Kalan Ali, as well as Shid Barrett, our administrative assistant. So we met, we discussed, and we set the agendas for the September Committee of the Whole, which we've already had, tonight's general board meeting, and as well as study session, which is, for those that are keeping track of it, it is this coming Thursday evening. Okay? So we also cover things like stories that inspire the current COVID-19 and COVID vaccine situation, and then as well the annual plan needs assessment contracts. So on the topic of study sessions, I wanted people to know that is from 5 o'clock. Yeah, from 5 to 8. It probably won't go that long. It is here at the building or via Teams, and the topic is board member trainings and annual reviews. A lot of that's now going to be on Boardable, and this will be the tutorial to help you understand how to get to those, go through the exercises, sign off, and certify for many of those items. All right, so hoping to see you all there one way or another. On the same note, I'll move into my updates. Dana and I met September 7th and met with the county commissioner and board vice chair Marcia Gershenson and county commissioner and chairwoman of the Public Health and Safety Committee, Penny Lowe's. We discussed the continued strengthening of our long-term relationship and on our board's current vacancy, and that would be Eric Lindemeyer's recent resignation. I stressed the willingness of OCHN to provide any additional community services and supports where needed, whenever, however, the county sees a need and requires quick action. Because from what I've seen, our organization is ready to step up and help them out even when the county health department needs a little bit more time to study the situation. So I want to applaud all of you guys for helping in us building that bridge. I also asked them to consider continuing their efforts to diversify our board so that it better reflects the demographics and the geographics of our citizenry across the county and the community. They said they would be posting the opening and looking to solicit applications, but as well, we too could post their notices on our website to encourage participation. And they would consider and look to us for any recommendations on the applications, potentially. Doesn't mean that they'll vote yes on every one of those, but it certainly would consider it. So I have not seen that opening posted yet, but I just wanted people to be aware of it. Then two more things. Continue your advocacy efforts. Use the CMHA outreach tool at cmham.org to reach out to your state senator, your state house, the DHHS, and the governor about the negative impacts, the ramifications, and the consequences that will happen to the people we serve if the state moves from today's public option to a privatized solution. Realize that our current situation, our current public solution is significantly underfunded. It really is. I know. Even though we seem like we're growing in budget, it's always been underfunded. So going to a privatized solution, if that organization wants to make a 5% profit, means that $125 million of the current budget would go directly to their bottom line or their profit and not to people receiving services. So if you want that to happen, stay silent. Otherwise, take a few minutes and advocate for the persons we serve and support. So, and the other is, if you haven't made your PAC donation, and I did it recently online, please go out to www.cmham.org or write a check, pass it to Sheila or pass it to Patrick. It's not tax deductible, but it does help us gain visibility and access to our legislature. And I think that's important. I think that's not just important, but it's necessary given the redesign efforts that are going on and for next year's election cycle. I know that Dr. Guadalupe isn't on the call tonight, but she did report on the upcoming fall conference, which is Sunday, October 24th through Tuesday, October 26th. Most of you, if not all of us, have received a survey from the association to understand who might attend virtually, who might attend in person up in Traverse City. At this point, it's definitely going to be hybrid, so it will be virtual and in person. So I'm asking, because I know it's so challenging to get hotel rooms up there, to reach out to Sheila. In fact, if you guys are on the call now, let's find out possibly who's planning to attend virtually.
This is Christina Root. I'm interested in, oh, sorry, not attending virtually, in person.
You're going to attend, okay. Yeah. So right now I'm just trying to find out who, because there's a registration fee for virtuals, and then there's, and we can go open mic for this. So Makaya, I see your hand up, but I'm asking anyone going virtual. Okay, who's thinking about going in person? So I got Steve, Christy Root, I myself, Makaya.
Yes, I'd like to attend in person.
Okay. Anyone else that's on the call right now, if you know? Okay. If not, certainly reach out. Sheila will be reaching back out to all of you as well. We're just trying to get a feel for how many. And then I've got a couple other minor briefs.
Mr.
Our
Lansing,
CEO, yes, ma'am.
before you move on, I'm curious, does everybody on the board, are they receiving email from the association?
No.
No.
I don't think so.
Okay. Okay, so
we need to fix that.
We will take care of that. Thank you. All right. So for those of you that have not received any emails from the association in the past year or two, please email Sheila and let her know what is your preferred email that you'd like them to send that information to. It does not have to be our Outlook. Okay? And I suspect that maybe they have our OCHN Outlook email addresses. Okay. Let's see. Our CEO, Dana Lazenby, reported that we had a number of proposals submitted to the county for CIT, co-responder, DIS education, DSP wages, and school mental health. She attended the SCRHM conference September 8th to the 11th to get a better handle on what could we do about our HR and make this the best place to work, if you will. Which I think it's a pretty good place. But I'm just a board chair, I don't work here. And then as well, that she'd be attending the MAC Policy Conference up on Mackinac Island, and that's going on right now. And then last, our Chief Legal Officer, Kalana Ali, reported an update on various legal matters. She also provided a reminder if board members are contacted directly by our provider organizations or their attorneys regarding any operational issues, or if it's a dispute or a legal issue, those kinds of correspondence should be directed to me, to Dana, or to Kalana, or all of us, okay? It's okay to acknowledge receipt, but please do not try to resolve the situation. Just let them know you've gotten it, you forwarded it on, okay? And that concludes my report. Let's see, I know with Sarah out, there's no Policy Management Committee Chair report tonight. I believe that with Rena out tonight as well, there's no, Rena Davy Dyer, there's also no Business Operations Committee Chair report either from this recent Committee of the Whole meeting. So next item on the agenda is the OCHN Employee Benefits Summary, and that's going to be presented by Edna White. Please, Edna.
Okay, good evening, everyone. I hope you can hear me okay. I am live on site here in the Superior Conference Room. And this is an annual update on our employee benefits summary for the benefit of the board to learn more about what we're doing with our benefit plans. And we'll go ahead and get started. Next slide, please. We wanted to give you an idea of what we are looking at in terms of demographic numbers related to benefits participation. We currently have about 196 employees on the payroll, and we have a very high uptick rate. 191 of our staff are participating in our insurance plans. Excuse me, we have 191 employees as of 7/31. And we're looking at 178 of the staff who are participating in one form or another. And when you take into account family members, spouses, covered people under the employees' plans, you're looking at a total number of 418 individuals covered under our benefit plans. We have 73 staff who take advantage of the family plan, 40 who take advantage of the two-person plan, and 65 individuals who are participating as single covered individuals. And it's really important that we look at organizing our benefit plans in a way that helps us attract and retain our dedicated, knowledgeable, skilled staff who are delivering on these programs and services that you hear about at each meeting. Can we look at the next slide, please? So for those of you who were not present for previous presentations on our healthcare plans, I want you to know that we offer a variety of options for our staff while looking at ways to contain costs. So we have two offerings for our staff. They're both Blue Cross plans. We have a preferred provider product for our staff and a health maintenance organization plan for our staff. We do have some staff who have chosen to opt out of our health insurance plan, and we also offer a standalone telemedicine product for our staff as well. We cover our staff for Blue Cross, for dental and vision, and we also offer our staff coverage under life, accidental death and disability, and short and long-term disability plans. Next slide, please. We utilize the services of Assured Partners. They are a benefit plan provider, consulting organization. They have a local office here in Wyandotte, and they also have a nationwide presence to help with compliance support and information on important regulatory changes to benefit plans. They are employee benefits manager, and they're able to leverage local market expertise as well as having robust resources on the national level. They offer us customized plan solutions. They meet with us regularly throughout the year. They give us enrollment support for open enrollment and also for enrollments for new hires, any changes that occur as part of a person's family life, whether they are adding new dependents or making changes. They offer ongoing troubleshooting and support in case anyone has any claims issues that we need to investigate. And they offer us a lot of support during open enrollment. In addition to enrolling staff in the plans that they choose, they previously came on site to support us, but we had to do a virtual open enrollment last year. But they were there to support us via Teams, and they provide the documentation that satisfies the employees for informational support as well as filing our regulatory documents with our providers. They support us by doing an annual bid to local insurance provider markets. They come back to our HR committee consisting of individuals on our executive team in HR. They provide us with quotes, utilization data. They give us projections on what future expenses would look like, as well as various insights into what the utilization data provides to us. So we're able to get information about what's happening trend-wise with drugs or with certain types of illnesses. All of the information is aggregated, so we're not able to point to one person or whatever, but they do let us know what our trends are like as an organization. Can I have the next slide, please? I'd like to also give you information about the way our health plans are designed. So we have purchased an off-the-shelf product for Blue Cross, whether you're talking about the HMO plan or the PPO plan. They do offer different types of network designs. With the HMO, it's a more defined network where you select a primary care physician. You would then seek referrals to get specialty services. It's a much more expanded network on the PPO side, where you can pretty much select any participating provider in the region who works with Blue Cross. These plans both come with high deductible and co-pays. However, OCHN maintains a self-funded health reimbursement account that funds those in-network co-insurance and deductibles for our staff. We also have a standalone pharmacy benefit manager. It's called EHIM. They're located in Southfield, Michigan. Their card is accepted all throughout the region for both mail order and pharmacy services. And we have a multi-tier plan with different tiers for generics, preferred formulary, and the non-preferred formulary. I'm going to stop right there and see if anyone has any questions about the design that I just described.
Is there anyone remotely that has a question?
All right, seeing none, may I have the next slide, please? I was able to do a look back and present the board with an overview of what our expenses have looked like over the last few years, just for comparison's sake. So you're able to see what the premium breakdown has been, and this is how much we pay for the premium for the coverage with Blue Cross, the amounts that we have spent for the health reimbursement account, how much on a calendar year basis we have paid out for prescription drugs, and what the totals have been over the year. So you see the totals for 2018, 2019, and 2020. As you can see, there was a dip in 2020, but that's consistent with what happened with COVID, with a lot of non-emergency services being curtailed. I also was able to provide you with where we are standing as of the end of July on a year-to-date basis. And if the trends continue, you'll see what the projected expenses are on a total basis for 2021. This does not represent the amounts the employees are contributing to offset these costs. These are just overall costs. I also wanted to include information about our retirement plan benefits. One of the things that is unique about our organization, but not so unique when you consider other governmental organizations, is that we do not participate in Social Security. The 6.2% that employees would normally contribute to the Social Security Trust Fund still comes out, but it goes into a private 401A account, which OCHN matches at the Social Security rate as well. There's currently about $22,436,000,000 in plan assets. We have been in this account since 1999 when we became an authority. We We also offer a defined contribution plan that takes the place of a legacy pension. So we don't have the legacy pension obligations. This is a defined contribution plan. OCHN will contribute 5% of employees' earnings into this account on behalf of the employees. If an employee does do a voluntary contribution, set at 2.5%, OCHN will match that as well. And we have $19,854,000 in plan assets in that account right now. I wanted to include survey data for the board to observe. We do participate in the Great Places to Work that Board Chair Langston spoke about, that our CEO wanted to look into. And when we did conduct a survey last year among our staff, in answer to the question, we have special and unique benefits here. 93% of our staff either said they agreed or strongly agree with that. And when asked the question, people are encouraged to balance their work life and their personal life, 92% of staff indicated that they either agree or strongly agree with that information. So that's really important to us. We survey our staff, we speak to our staff, we engage in conversations with them all throughout the year to understand what they are seeking in a benefits plan.
Analysis with 101 different articles.
Yeah, can everyone who's on the call please mute? Thank you.
Thank you. When we survey our staff and have these conversations, we understand that this type of plan design is really important as we look to attract and retain the staff that we have. So I am going to stop right now because I see a question from Don.
Thanks, Ms. White. Okay, for this survey, was it anonymous?
Yes, it was.
Yes, okay, great.
It was conducted by a third party, and all of the information went directly to this third party for collection.
Thank you.
All right, other questions? I see Hadas has her hand up. Hadas, please. And you're still on mute.
Thank you. Regarding the retirement plan benefits, I was wondering who reviews, since we've been doing it since 1990, who reviews the percentage of the shared funding and the money that the OCHN match goes to, and then the, the contributions. I mean, I'm completely supportive with what's going on. I'm just wondering if it should be higher and how those numbers, the percentages come about every year, if it's gone up, down, just the history there.
So we have modified the plans. We work with an organization that's based in Washington, D.C., formerly named ICMA. They are now called Mission Square. I will be providing you with more information on that related to their name change. And we have been with that organization since 1999. They specialize in providing retirement plan services just for public service employees. They are a not-for-profit organization. And as we meet with them and we learn about what's happening trend-wise throughout the industry, we have made modifications. Anya, I want to say it was 2015 or 16 when we added the 2.5% match as an option for our employees. We did have a structure where former county employees were receiving a higher match, and we leveled that off so it was applicable to all employees equally. So there was an arrangement where county employees received, people who, I should say, transitioned from service at the county to OCHN back in 1999. They had a grandfathered higher match rate at 6%. And so we took steps to level that off so that it was equitable across the board. but we meet with them regularly. They provide very detailed information about utilization, how many employees contact them on an annual basis. We have them coming to our office several times a year or virtually that we're doing now to provide presentations and to give one-on-one consultation to staff all throughout the year.
Thank you.
You're welcome.
Now, Kaya, you have your hand up as well.
Yes, thank you, Jonathan. Thank you, Edna, for your presentation. I'd like to go back to the point about the organization. I'm sorry. Assured Partners.
Yes.
Is, if I understand you correctly, are you saying that they do put out our benefits, so to speak, or our program out for bid, and then they handle the bidding process and come up with a provider for us every year? Is that what's going on?
No, we select the provider. They give us the results of the annual bid process. They present information about our number of staff, our demographic information, the type of organization we are, and we receive back several quotes on an annual basis. So those executives on the HR committee will then consult internally and make a determination of how we want to proceed with the benefit plan for the following year. So that's our decision.
And when they're, I'm sorry, I didn't mean to interrupt.
No, I'm done.
And when they're bidding out, do they ever consider local businesses? Is national, how big of a net do they throw out when they're looking for potential places to handle our business?
In my history, we have seen, all levels of providers presented to us. Very large national organizations like Aetna, local Blue Crosses, Priority Health. It spans the gamut.
Okay. Thank you.
You're welcome.
Is there anyone else on the board that has a question about We're Local? I just want to take a minute right now and just say that I do work with Blue Cross. I am part of the Medicare Advantage team, so that's for above 65. It's part of Medicare programs. It is not part of the commercial plans that our organization looks at. But either way, I'm not going to vote for anything related to who we choose or how we choose. I'm going to recuse myself, just so that folks know.
Thank you. Can I have the next slide, please? The last piece of information I want to share about next plans. I just came back from vacation, and we are looking to schedule the sit down with Assured Partners. They are ready to prepare all of their due diligence reports for us, and so we will review that information internally. We will develop an employee benefit pricing model. I have prepared a Public Act 2 resolution to our OCHN board. We will be requesting approval from the board so that we can opt out of the requirements under PA 2, Public Act 2, that set a mandate for public employees to pay a minimum of 20% of their health care costs unless the governing board allows an opt-out. This is something we present every year. Our board has permitted us to opt out of the requirements of the Public Act on an annual basis since it was enacted in 2012. It's very important to us that we be able to make our own decisions and understand what our employee needs are while balancing the responsibility of being able to act appropriately in terms of our cost structure and our administrative budget. We will make a plan to roll out open enrollment for the 2022 plan year, and we will have a administrative contract with Blue Cross once we, well, I said Blue Cross, but it would be with any health plan that we choose. Right now, we have one with Blue Cross, and we will be presenting that for approval to the board. And as we do all throughout the year, we do monitor cost utilization so that we can develop a strategy for the following year. I mentioned what was happening with ICMA, now Mission Square, and there is a service agreement that needs to be renewed relative to their name change. Nothing else has changed about the administration of the plan. They just have a new name. So those are our next steps. And with that, I will close out with any other questions that the board has.
Are there any questions locally? Steve?
Just a comment. I believe that Oakland County itself uses the opt-out option. Right? Is that still correct?
That's correct. Thank you.
Anyone remotely? All right. Thank you for presenting the information on how we do this, how we find the right benefits for our folks. Why it is a great place to work.
Thank you. I did include the opt-out resolution in the board packet, so that will require a vote.
And that's later in our agenda.
Okay. Thank you.
All right, thank you. Next item on the agenda is the budget. Anya?
Okay, so in your packets you have the budget documents that you saw at the last study session. And since then, we've made a few updates. So my intent tonight is to cover the updates that have been made since this was presented at the study session, and then answer any final questions before this does go for a vote, which I believe is happening tonight. So the biggest update that happened between the study session and tonight is that we did get information from the state that we were likely to see that $2 direct care wage increase continue. So they did go ahead and put it in our rates. Since then, as of actually today, I did hear it as $2.35. So the budget you are looking at, because I couldn't change it that fast, only includes the $2. So what you'll see in both revenue and expenses is an addition of a few $1 million, a total of about, I think it's, total revenue across the entire thing is about maybe $12 to $15 million for that $2 increase. It's equal to the expense amounts represented below that. And so that will total $3 that we will be not only continuing with the prior years, but also that increase of $1 that we had already built into the budget. So what will happen is, as of 10/1, we will roll out the $2.35, and I will include the 35 cents in the next amendment. So the first amendment I do will update that revenue and expense number, but we won't want to make providers wait for that money. So we'll include that in their rates starting on October 1st. So that's primarily the biggest adjustment since the study session. The other adjustment is related to the CCBHC. We did receive rates for the CCBHC in our capitation rates, and we're able to quantify those. So that was an increase of about $4.1 million. Again, the revenue equals the expense at this point because that's just what we're expecting. So no material impact on the bottom line. So in total, you can flip over to that last fund source summary page. And you can see it puts us at roughly $11.3 million surplus in Medicaid, roughly $2 million surplus in local money, and then roughly $2 million surplus in PA2 for a total surplus of about $15 million. I'll say this again because I have to say it every time. Our goal right now is to be able to put money into our Medicaid savings because we did use all but $300,000 of it in fiscal years 18 and 19. So my hope is that in fiscal year 21 we will do so, as well as in fiscal year 22, while still investing in not only the direct care wages, but also in the clinical staff at the provider level wages, as we have seen an increase from a market perspective. So we're trying to cover all aspects of the needs right now, including increasing access with expanded access hours in the Children's Crisis Center. So trying to hit all of those key points that we know are in need of investment with this budget, and make sure we're covering all those when the funding is available. One of the things that did change just slightly, I do want to mention, is that the state does believe that the emergency protection order that keeps people on Medicaid is not ending at the end of this calendar year. So what that means is anyone enrolled in Medicaid stays on Medicaid through at least they believe the next fiscal year. So the way that impacts our rates is essentially they don't expect people to fall off. So they expect eligibility to be higher, which then means our per member per month rate is just slightly different. It all works out in the end, but just so you're aware, they did make an adjustment for that. So it does actually decrease what the per member per month rate is, but because the eligibility will be higher, it offsets it. So all of that said, I'm pretty happy with the way this has played out thus far this year. Certainly we'll be watching it closely in the first quarter and be talking about if anything is materially different for the first amendment, hopefully in December. With that, I will take any questions.
Are there any questions, recognizing this is an action item later on in our agenda?
Can you just clarify the dates for the Medicaid? You said the fiscal year, it'll continue, but will you put dates on that, please?
So it was due to expire at the end of this calendar year, I believe, and then they've said they expect it to continue at least through the end of our fiscal year, which would be next end of September. And if that changes, they will adjust rates accordingly. Okay. But that's what they're saying, because they fund us on a fiscal year, so they believe it will be at least through the fiscal year that these rates would pertain to.
Okay. Thank you.
Yep.
Any other questions? All right, thank you.
Yep.
Next presentation is on the topic of credentialing, and Marquita is going to be presenting continued conversation we had about vet systems.
Good evening, everyone. Can you hear me?
Yes.
Okay, last week at the Committee of the Whole, I presented to the body about a contract that the OCHN was planning to enter into with board approval with a credentialing verifications vendor under the name of Medverson. The contract amount at that time was for $111,000. Following the board meeting, we reached out to the vendor to engage them into some contract negotiations for pricing. The vendor agreed to decrease the contract by almost $20,000. So that brings the actual amount that the vendor agreed to decrease the contract by was $19,500. So that brings the contract amount to $91,500. It's important to note that this contract negotiation in terms of costing would have occurred anyway naturally as part of entering into a contract with the vendor. The contract was presented to the board last week with the price of $111,000, with the expectation in the event that the vendor was not agreeable to reducing the contract amount. My intent tonight is to go over some of the key points of and benefits of engaging with a CVO for handling this function for OCHN, and to answer any additional questions that the board may have. Another important note that I want to bring up is following the board meeting last week, we also reached out to a couple of vendors to get an idea of the kind of services that they could provide in regards to credentialing. In the short amount of time that we had, I think I heard back from about a few vendors, and what we did hear back was there are other vendors out there that can provide this service. The pricing is somewhat less in some instances. For one particular vendor, they can do this for a lesser amount, but a lot of the work that is required to be done is manual, and it doesn't really remove the burden from many of the providers are from OCHN. Another vendor that responded to the inquiry is able to do the work, but it's more of an a la carte type of a product. So you would have separate products that you would buy for ongoing monitoring, for the sanctions, for the application process. So it's just not as smooth of a process as it would have been as it would be with Medverson. We can move on to the next slide, please. So I just want to touch on some of the key points that we talked about last week, and just to stress some of the benefits of using a CVO. Of course, I spoke about last week how prescriptive and stringent the credentialing process is. In terms of benefits, it protects the organizations in terms of any financial risk that you can encounter, and also for reputational risk. Just a couple of weeks ago, there was a story in the news about this is a local organization that had a staff person on staff that was posing as a professional that did not have the credentials to actually provide those services. That was not a provider in our network, but if if a person is posing as a professional and doesn't have the actual credentials to perform the job, an organization is liable for having to pay back any services that person has submitted for billing. And that's also a mark on an organization's reputation for not having strong and stringent credentialing processes. So that is not something that an organization wants to really endure. The last bullet point on the slides that I want to stress is the plans that the state has for implementing a uniform credentialing process. Public Act 282 that was enacted in 2020 is a plan for a universal credentialing process. So this is a process that the state is going to be implementing. There is a work group that is being formed to work on this. So the ultimate plan is to have a profile statewide for professionals for the credentialing process. So using a credentialing verification vendor puts OCHN in a position to be in a spot to really be a lead in that area, because we will already have a process in place that aligns us with what NCQA is requiring and other accrediting bodies. We can move on to the next slide, please. Here, I just want to highlight some of the delegated functions that OCHN is responsible for. In terms of NCQA, we are responsible for the oversight and monitoring of the delegated functions of credentialing, for portions of utilization management, and also portions of care coordination. So having strong processes in place to be able to monitor and have oversight of the activity that's happening in that area is a definite benefit to OCHN. Another point that I wanted to highlight is that OCHN, this credentialing has not been a problem area for OCHN in terms for credentialing our practitioner staff. This is an area that we're audited on every year by the External Quality Review Organization. The organization that the department contracts with for this function is HSAG, Health Services Advisory Group. Over the past years, historically, OCHN has always received a MET in this area. So the credentialing process has not been a problem for OCHN in regards to the expectations. Another point that I wanted to stress with the board is that the cost savings that could be experienced by using a credentialing verification organization. The average cost for a credentialing analyst is about $50,000 a year. So thinking about this conservatively, if this individual was to spend at least half of their time doing the credentialing and recredentialing function, that could potentially save an organization about $25,000 a year. So right there's a definite cost savings in regards to using a credentialing verification organization, because the resources that are used within the organization can be realigned to other functions within the organization. In some organizations, we have staff that are wearing multiple hats. In some organizations, you have clinicians that are kind of wearing dual hats, performing credentialing and also serving as a clinician. So we want to be able to free up resources to be able to provide the services where they are really needed. We can move on to the next slide, please. Just to give you an overview of how the process works, the department requires that credentialing and recredentialing be done every 2 years. Using this vendor, MedPercent, it's a totally automated process. It really takes it out of the hands of providers that may be using MedPercent and also out of the hands of OCHN. The way it works is that a link is actually sent to the practitioner with the request for them to complete their application and materials to begin the credentialing process. So the practitioner completes the application, completes the attestation questions, and submits the completed information back to MedPercent. The practitioner has the option to provide consent authorizing the release of their information to other entities. That helps with the process of reciprocity. So if you have a practitioner that may be working in another county, that person does not have to go through another credentialing process because they would have already gone through a credentialing process under the CVO. Once the application materials are received at MedPercent, MedPercent begins the process of verifying their credentials. And then after that process is done, all the primary source verification sources are checked and vetted. The report of clean files are sent back to OCHN for review and approval by our credentialing committee. So there really isn't, there's minimal work that would have to be done by OCHN in terms of deploying this. Our role would be to send a list of practitioners that are due for credentialing to MedPercent. After that, the process is really handled by MedPercent, so minimal work to be done by OCHN staff. We can move to the next slide, please. Elements that are included in the cost of this contract, there is a cost per practitioner, which comes to about $80 per practitioner. That includes the actual application intake and then all the various checks that you see listed there. In terms of technology, MedPercent has an electronic process. They have a client portal that staff at OCHN would have access to if we ever need to get into that to verify any documents that have been submitted as part of the credentialing process. There's also the application portal that the practitioner actually submits the information to. There's a call center, which is basically a help desk that we would have access to reach out to for any technical assistance. And then there's also an implementation and setup fee, which I spoke about a little last week when I spoke about this with the board. We can move to the next slide, please. So just to go over more of the benefits in regards to using a CVO, if an organization uses a credentialing verification organization that has been approved by NCQA, you're going to receive automatic credit for any of your credentialing files that have to be reviewed by NCQA. So that right there is a benefit in itself because the credentialing is a very prescriptive and strict process that if all your I's aren't dotted and your T's crossed, you stand to lose points. This is an option so that we won't have to really have a concern in that area. I spoke about how it reduces the administrative burden because it allows the realignment of resources, and it frees valuable resources to provide staff resources to be able to focus on many of the other priorities that are coming down the pike from MDHHS. One would be the CCBHCs. That is a heavy lift for PIHPs in regards to ensuring that we're up and ready to go and that we're addressing all the requirements that have to be in place for that. And another area that resources would be able to be devoted to, it would be the implementation of the Michigan Crisis and Access Line. So this this would allow the ability to free up some resources to be able to devote to some of these very important priorities that the department has handed down to us. And then lastly, this also helps to support reciprocity, which I spoke about in terms of if you have a practitioner that's working in one county, but it's also working in another county, if the practitioner has already gone through the credentialing process in one area, being Oakland, they would not have to go through that credentialing process again if they've given consent to share their information. We can move to the next slide, please. So that was a very high-level overview. I wanted to provide the board with more background information, and at this time I can answer any additional questions that you may have.
Anyone locally here?
I have a question.
Go ahead, Christy.
This is Miss Root. So on the slide where it says, how does the process work? One thing that came to mind as a possible challenge is the practitioner receiving an email and not opening it or completing the application. And you mentioned that OCHN will have to do minimal work. So is it correct that MedPercent will do all of the follow-up work with the physicians?
Yes, it's our understanding that MedPercent will reach out to the practitioner initially, then they will do additional follow-up if they are not receiving a response from the practitioner within a timely amount of time, a reasonable amount of time.
Thank you. And I just have one more question. Do we still plan on doing a formal RFP process in the short, or like in the near future? And if so, when? Because this is only for 12 months, right?
Yes, we are still planning to RFP this next year.
Okay. Thank you.
Is there anyone else that has a question for both or local? Marquita, I have a couple of questions for you. You said that you've identified roughly 400 people, and I was trying to get a sense of some of the roles. Will this include folks that are licensed with the state, like case managers and social workers as well, across our various providers?
The 400 estimate would be master level practitioners and above. So we're talking about our LMSWs, our LPCs, MDs, DOs, all those individuals.
Okay, so that's what I thought. It seems like we have more than just 400. Okay. The other is, one of the challenges that I remember from our RRAC side, so recipient rights, is there are frequent flyers. So people that move from one place to another after causing a problem here or there with substantiated issues, and we haven't got a clue when they show up working at somewhere else, and they've been background checked and credentialed. By going to a tool like this, assuming they are at that MSW or that licensure level, will we now have visibility to those folks when they move from facility to facility or organization to organization?
So MedPercent does include in their costing background checks. So if there is an issue that is reported to law enforcement or to licensing, that would come up in the MedPercent checks. But if it's something that's reported locally, such as a substantiated recipient rights complaint, they would not have that.
Okay, but we'd at least have visibility when they move from one place to another and they're seeking re-credential, right?
Yes, if it was something reported to law enforcement or to licensing, yes.
Okay, what about sanctioning? Because some of our providers can bill Medicaids and stuff, and that's a big no-no sanction.
MedPercent does do ongoing credentialing checks, and that includes sanction checks.
Okay, that's good. I wasn't sure, I didn't see that in there, and I had worked with both NCQA and CAQH credentialing systems before, so Awesome. That was it for my questions. Thanks. All right, and again, this will be an action item further down in our agenda. Okay. Thank you,
Thank
Mark.
you.
All right, next item on the agenda is, I believe it's our capital services contract. Christine Burke.
Actually,
What?
at this point, they were presented at the house, so we're just going for approvals. We
Ah,
don't have a
okay.
presentation.
Okay, then we don't need that. So we have discussed this item, so we'll start at the top and we'll do these one by one for roll call approvals. So we have a capital services contract, that's with our lobbyists, with Ben and company. So I need a motion to approve that capital services contract.
I move that we accept the capital services contract.
Okay, thank you, Dr. Taub. Is there a second?
I'll second.
Thank you, Ms. Ruth. Is there any discussion? Adas, your hand is, I'm seeing your hand is
Yeah,
up.
it was for it's for the CPI, but we'll wait till we get there. Sorry about that. I'll put
Okay,
it down.
that's okay. All right, so we've had a motion, we've had a second, there's been no discussion, it's been presented and questioned at the COW. So let's do a roll call on this item.
Mr. Cowan? Dr. Hans?
Yes.
Ms. Newman?
Yes.
Dr. Taub?
Yes.
Ms. Root?
Yes.
Mr. Furman?
Yes.
Ms. Bernard?
Yes.
Mr. Torres?
Yes.
Mr. Cowan? Mr. Landsman?
Yes. So I've got a yes and one no vote, or one
No,
not
no.
vote.
I have 3 absents, 8 yes.
Okay, so the motion carries. All right, the next item is the communications professional contract. And that's with audiovisual equipment. And again, this is with CPI, Board Communications. And again, we discussed this at the Committee of the Whole last week. Had a fair amount of Q&A. And so again, there's a motion, or I'm looking for a motion to approve this contract.
I move the motion.
All right.
Go
Thank
ahead,
you, Ms.
Adam.
Oh,
I move to approve the communications professional contract.
thank you. Is there a second?
I'll second that motion. Malkaya.
Thank you. So we have a motion. Is there any discussion? Okay. So there's been a motion by Mr. Furman, a second by Ms. Newman. There's been discussion and Q&A at the COW. So let's have a roll call vote.
Hadas has her hand up, Mr. Landsman.
I'm sorry, Hadas.
I think she may be muted.
Thank you. I don't know why I keep doing that. I apologize. So I just don't, and I look at it now, I still don't understand how we get to the not to exceed number. And I don't know if anyone can explain it. If not, if that's okay. I just don't understand how that number comes up. It's in the first paragraph. The audiovisual contract to not to exceed, where that number comes from.
So in the board communication, we added a combined NTE for both AV and security. And so if you were to take, we have for each fiscal year, we totaled up what those amounts are to get the total NTE for the respective contracts.
Right, but if you take 479 and add in 9, how much is it? How much are you adding to the not to exceed? It was 479, but now it's 488.
So we're adding just to make sure that we're reconciled with the expenses in the table. On the board documentation, it is, or I'm sorry, the board communication, it is just over $9,000.
Okay. And is that from fiscal year 19, the $9,000?
So Hadassah is on it, can I just jump in? So are you looking at the updated board communication that has the fiscal year 18 expenses included?
Yes.
Okay, so that document, it was one contract for fiscal year 18 and then split for 19 and forward. So what we're doing is giving, so the split was done originally, and then since then there have been expenses attributed to each contract. So we're reconciling those two amounts and then adding what we think we will need for fiscal year 21. Does that make more sense?
No, that makes sense.
So that table at the
I just
bottom-
wanted to know where the 9,000 was. If it was coming from 19 or it's coming from 21, or it's just because it says the total 9,822 and 21. Is that what it is?
So if you look at this, the table on the document you have for fiscal year 21 says, I'm sorry, what? Are you looking at that table?
Yes, I am.
Okay. So if you look at the 9,800 and the 7,500, those are reconciling to the expenses that we used and will need for fiscal year 21. The intention would be to bid this out for next fiscal year.
Yeah. Okay, thank you. That answered my question.
Thanks.
And Hadassah, I apologize. I thought you said CTI, T as in Tom. And so I thought there had to be an item further down. I did not mean to rush you. Okay. So is there any more discussion or questions? If not, we'll call the question with the roll call vote.
Mr. Collin? Dr. Hans?
Yes.
Ms. Newman?
Yes.
Dr. Tom?
Yes.
Ms. Root?
Yes.
Mr. Furman?
Yes.
Ms. Bernard?
Yes.
Mr. Torres?
Yes.
Mr. Landsman?
Yes.
Motion carries.
All right, the motion carries. We have 8 votes. All right, the next item on the list is our printing RFP, or actually our contract, and that's with Allegro Printing. And so I'm looking for a motion to approve this contract. For our public communications.
Mr. Lance, I'd like to make a motion to approve the Allegro contract.
All right, thank you, Ms. Newman. I should let you know that it's somewhat garbled. You might want to come stay off camera and just go to audio, because sounds like there's a bandwidth issue. Okay, Ms. Newman? All right, so we have a motion to approve. Is there a second?
Second.
Okay, Dr. Cobb seconds. Is there any discussion on this Allegro Printing contract? Seeing none on the wall, hearing none, let's call the question for this one.
Dr. Hans?
Yes.
Ms. Newman?
Yes, can you hear me?
Yes.
Dr. Tom?
Yes.
Ms. Root?
Yes.
Mr. Furman?
Yes.
Ms. Bernard?
Yes.
Mr. Torres?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Budget carries, thank you. The next item on the agenda is approval of the Manor Solutions contract for our finance business software. And that would take us from our current, what is it, Great Plains? To, I don't know, the Microsoft Business Back Office, right?
Business stuff.
Okay. So is there a motion to approve this contract?
I'll make a motion to approve the Manor Solution contract for finances.
Thank you, Ms. Newman. You're coming through loud and clear. Is there a second?
I'll second.
Thank you, Ms. Ruth. So we have a motion, we have a second. Is there any discussion? Hearing none, let's call the question.
Dr. Hans,
Yes.
Ms. Newman,
Yes.
Thank you.
Dr. Cobb,
Yes.
Ms. Root,
Yes.
Mr. Furman,
Yes.
Ms. Bernard,
Yes.
Mr. Torres,
Yes.
Mr. Landsman,
Yes.
motion carries.
Thank you. The motion is carried. All right, the next item on the agenda is the Medperson credentialing contract. So I'm looking for a motion to approve this contract.
Steve Cobb, I make a motion that we approve the Medverside contract, even though we don't have to.
Yeah, do we?
We don't have to, but
We don't have to, but you guys have presented, it's transparency, so we'll take a vote. We'll give you support if it passes. How's that? All right, there's a motion. Is there a second?
I'll second Steve's motion. Malkaya.
Thank you, Ms. Newman. So there's a motion, there's a second. Is there any discussion? Is there plenty of discussion? Okay. How about we call a question on this one?
Dr. Hans,
Yes.
Ms. Newman,
Yes.
Dr. Cobb,
yes.
Ms. Root,
Yes.
Mr. Furman,
Yes.
Ms. Bernard,
Yes.
Mr. Torres,
Yes.
Mr. Landsman,
Yes.
motion carries.
Motion carries. And again, we're supportive of credentialing. Protects us, protects our providers, but most importantly, it protects the persons we serve. Okay, next item on the list is PA 152 resolution. This is the resolution that allows us to provide a lot more. I think this is the one that's, you said it was 2 before, right? But isn't this the one that expands our benefit package?
Yeah, it allows us to opt out.
Right.
Allows us to opt out.
Right.
PA 152.
Right, because on one of the earlier slides, I saw it as PA2.
Oh, I think it's the letter structure.
Yeah, that may have been a typo. Okay.
Can I have a clarification on this, just for the motion?
Sure.
Are we doing the benefits package with the resolution, just because we're doing the budget, or are we doing them as 2 separate items?
I would like to do them separately because I can vote on the resolution, but I don't think I can vote on the
Okay,
benefits,
okay,
or I prefer not to.
okay.
Okay. So we are looking for a motion for the approval of the Act 152 resolution for the current year. Is there
I'll
someone that
make
will
the motion to, I'll make the motion to pass resolution PA2.
Okay, is there a second?
I'll second.
Thank you, Ms. Ruth. So there's been a motion to make it by Ms. Newman. It's been seconded by Ms. Ruth. There has been a fair amount of discussion. Is there any more discussion? Hearing none, we'll call the question.
Dr. Hans,
Yes.
Ms. Newman,
Yes.
Dr. Cobb,
Yes.
Ms. Root,
Yes.
Mr. Furman,
Yes.
Ms. Bernard,
Yes.
Mr. Torres,
Yes.
Mr. Landsman,
Yes.
motion carries.
All right, thank you. So is the next one for the actual benefits update? Or is that separate?
It's separate.
Okay.
That's a separate item when we get the agreement.
And we don't have that right now. Okay. I got confused for a second there. Okay. So next item on the agenda is the fiscal year 2022 annual plan and budget. And do we need, is there a presentation to go with this, or are we just voting on the resolution of the revised budget?
So this would be for the annual plan that was presented at the committee of the whole, and then the revised budget I walked you through today.
Okay. All right, so we need a motion for the budget and the annual plan for fiscal year 2022. Will someone make that motion, please?
This is Steve.
I move.
Go ahead.
Go ahead, Steve.
Okay, I move that we accept the annual plan and budget as updated.
Thank you. Is there a second?
I'll second that motion.
Thank you,
Go
Mr.
ahead,
Newman.
Mr. Kemp. Mr. Kemp can have it.
This is Mr. Cowan. Can you hear me?
Cowan.
Yes, we can.
Yes.
I apologize. I have been on the phone, but for some reason I don't know how I was muted, but I'd like the record to reflect my yes vote. Maybe we can do that later on all the other motions, and I apologize. I don't know what happened. I had to redial.
But we can hear you now. So you're making the second.
Well,
to the
thank
motion.
you very much.
All right. So am I clear? You're making the second to the motion to approve the annual budget and the annual plan for fiscal year 2022, Mr. Cowan?
Yes, I am. Thank you.
Thank you. All right. With that, is there any discussion on the motion? The motion's been made by Dr. Cobb. It's been seconded by Mr. Cowan. Dr. Cobb, Mr. Cowan. Let's call the question.
Dr. Hans,
Yes.
Ms. Newman,
Yes.
Dr. Tom,
Yes.
Mr. Cowan,
Yes.
Ms. Root,
Yes.
Mr. Furman,
Yes.
Ms. Bernard,
Yes.
Mr. Torres,
Yes.
Mr. Landsman.
Yes. That's now 9 votes, right?
It's 9, yep.
Okay.
Well, they're all 9, right?
Yes, now they will be all 9. Okay. All right, the next item is the total elevator, so the elevator contract. So I'm looking for a motion for approval for this item that was discussed at the committee of the whole.
I make a motion to accept the MEI Total Elevator Solutions contract.
Thank you, Ms. Newman. Is there a second?
Second, Adam.
Thank you, Mr. Furman. So there's been a motion by Ms. Newman. There's been a second by Mr. Furman. Does it require any further discussion? Okay, let's call the question on this one.
Mr. Cowan,
Yes.
Dr. Hans,
Yes.
Ms. Newman,
Yes.
Dr. Tom,
Yes.
Ms. Root,
Yes.
Mr. Furman,
Yes.
Ms. Bernard,
Yes.
Mr. Torres,
Yes.
Mr. Landsman.
Yes. Motion carries, right? Okay. Next.
Mr. Landsman, I have a question about
Yes.
this, about F. Is that been pulled for approval, or are we not approving that tonight?
Item F was PA 152. That is the resolution that allows us to offer a wide benefits package to our employees.
But the slide is showing F as OCHN benefits package approval item.
That's the agreement.
And I'm just questioning why has it been pulled, or are we not approving it tonight?
We don't have that package yet, so we can't vote on it.
If we don't have the totals.
Okay,
Thank you.
you're welcome. Okay. Next item on the agenda would be the CMHSP contracts from the state if they are in, and the PIHP contracts.
So you all should have received, this is Kawana, Chief Legal Officer for OCHN. You all should have received a copy of the current or anticipated FY22 CMHSP contract. We just received it as of late last week. However, upon review, we did note that the amounts listed for the general fund dollars at $21,618,366 is actually incorrect. We've reached out to the state to confirm this. They have indicated that the amount is in fact $10,809,183. I know that there were some additional questions regarding this amount. However, given the state's response on this matter, They did indicate that they wanted us to move forward with execution and that they will update the sheet at a later time. Is that correct? So egrams, just so that you all are aware, is a bit different. This is a system, I believe is somewhat antiquated, and no one really knows how to use it. So a lot of times what happens, and they've had this issue with other CMHSPs where the budget amount indicated on the contract is incorrect, and they've gone back to fix it later. So I would like to put this contract before this body today for your approval with the amount amended to $10,809,183. If that amount changes, however, I will represent this item to the board for its approval again if there's a change in the amount there.
So I need a motion to approve this agreement. And this is for the CMHSP contract?
Correct. We have not received the PIHP contract. The motion would be to approve the contract with the amended amount at $10,809,183.
Okay, so I need that motion. Someone?
This is Steve, I make so move.
Okay, thank you, Dr. Todd. Is there a second to approve the CMHSP contract as presented
Supported,
by?
Melchiah.
Thank you, Ms. Newman. So we've got a motion, we've got a second. Is there any discussion or question on it? I have a question, so I don't see anyone else. When do we have to get a response back to the state on approval or on this?
So the start date is 10/1/2021 for the fiscal, but
They usually require us to respond inside of a week or something.
correct. So they want it back sooner than later, and that was kind of the indication that I taken from that email that was received today. So they were pushing us to make sure we sign this agreement in advance of the 10/1 start date.
Okay, and I know, well, we do have a study session, but, okay. So we usually know when it's due back, and we usually know we don't have a choice anyhow. So that's why I was asking when they want that response back. All right. Okay, so we have a motion, we have a second. Is there any other discussion on this item? All right, let's call a roll call on this one.
Mr. Collin,
Yes.
Dr. Hahn,
Yes.
Ms. Newman,
Yes.
Dr. Top,
Yes.
Ms. Root,
Yes.
Mr. Landsman,
Yes.
Mr. Furman,
Yes.
Ms. Bernard,
Yes.
Mr. Torres.
Sounds like we're nine, we have a motion carried. Okay, next item on the agenda is we need a motion to approve the consent agenda, which includes board meeting minutes and meeting minute reports. Is there such a motion?
Motion to approve the consent agenda. This is Adam.
Thank you, Mr. Furman. Is there a second?
Seconded by Hadass.
Thank you. It's consent agenda, so there is no discussion. We'll move to a roll call vote.
Mr. Collin,
Yes.
Dr. Hahn,
Yes.
Ms. Newman,
Yes.
Dr. Top,
Yes.
Ms. Root,
Yes.
Mr. Furman,
Yes.
Ms. Bernard,
Yes.
Mr. Torres,
Yes.
Mr. Landsman.
Yes.
Motion carries.
Thank you. Other business? All right, so other business, we have,
Just a reminder, Dave.
just, yes, a list of upcoming activities. That has come to at a request by our board and for the public so that people know what's going on in the next calendar month or two. Well, what's been going on for the month, in this case, for September, and hopefully there's a page of what's going to be there for October, since we're almost there. If there isn't, I'm hoping Christine Burke will publish that for us, or put it on the OCHN calendar. Uh, Next item on the list is the fiscal, well, it's actually the 2022 calendar. It's not really fiscal year, but it's the January to December calendar. We all received this a few weeks ago. We're hoping that people can look and review it. I did, I'm sure others have as well. See if there are any conflicts. I did not note any. Sir? This is not an action item, but it is, no, is it?
It will be in October.
It will be for October. Anyhow, again, take a look at it and see if there's any conflicts with your own schedules. All right? All right. Next on the calendar, or next on the schedule is board reports. Tonight we have, we might have 4 board reports. So we'll start with the bylaw committee. Mr. Torres?
Thank you. Can you all hear me?
Yes.
Okay, perfect. We have had a September meeting for our bylaws committee. We've been pretty comprehensive so far. We've had about 4 meetings and reviewing all of through Article 4 into Article 5. We spent most of our time looking at Article 3, which regard to appointments, term compositions, and vacancies. We've also discussed board orientations and specific timelines on that when a new board member enters onto the board. Article 4, officers and duties, talked about the various different officer positions, the terms, what to do in situations of vacancies, the duties of the board chairperson and the vice chairperson. We spoke about our executive committees, our finance committee, policy management committee, and had some discussions on our executive director performance reviews and requirements on that. So we've been, I think the whole entire committee has been very active, and there's been a lot of good discussion, debate, and conversations. We're taking our time, being thorough, going through things. We found that a lot of things after we get through the actual articles, we're going to be needing to go into our board policies as well. So clarify some things that we can't necessarily put in the articles. But we've got a good group, and I will make sure we get the word out for our October meeting. We don't have a date set yet, but we were just going to have the one meeting in September. That's it.
Thank you for your update. The next item would be the Recipient Rights Advisory Committee, and again, Mr. Torres.
Mr. Landsman?
Yes?
Excuse me, sir. Are we entertaining questions of Mr. Torres on his report?
Sure. What is your question?
I wasn't here when the committee was formed. I'd like to know who's on the bylaws committee.
Yeah. So it's myself, Josh. I'm sorry, I don't have all my papers with me right now. Miss Namie Dyer, and Dr. Hahn. And then also we have the assistance of our lead counsel for OCHN, Kalana, and then Dana has been attending every single one of our meetings and participating as well.
Thank you, sir.
You're welcome.
All right, now for the Recipient Rights Advisory Committee report. Mr. Torres.
Thank you. And again, my apologies. I'm not at home, so I don't have my notes directly in front of me, so I'll get through as best I can. But we did go through our fiscal year 22 rights budget review. We received our rights manager update and an update on the recipients' rights training for guardians. That's been something that our committee has been very involved in, and providing appropriate education for guardians that that do receive those guardianships, that they know what to do, that they know what the rights are of the individuals who have the guardianships over them, and that we are providing that education in the best ways that we can to guide them through and to direct them to proper avenues of the courts. The discussion on the beyond tokenism presentation that occurred. We received an update on our site visits reports. It looks like even though the pandemic has made things a little more challenging and putting things in a more virtual format, there's been an acclimation to it, and they are on track right now to be able to finish all of the site visits for this year. We discussed the Dan Moran the Dan Moran Rights and Advocacy nomination form. We received 2 nominations for the for the award this year, and there was a little bit of confusion behind it because both of the individuals that were nominated were extremely qualified. However, we found some flaws in the nomination form that we would like to beef up on, so that in the future, individuals who deserve the award can get the proper nomination, and the committee can have full contact of all of the things the individual does. Yep, and that's everything we discussed. Thank you.
All right, thank you. Very comprehensive for someone without notes. Appreciate it. Any questions for Mr. Torres regarding the Recipient Rights Advisory Committee meeting? And those meet, you got another one coming up next, is it next Thursday? First Thursday?
Yeah, first Thursday of October. One thing I did want to add too, actually, going back to our bylaws, if anybody is interested in attending, any board members, you can attend. We do provide the link. It's a public meeting. We provide public comment. And, you know, we're open to listening on the public comment, both at the beginning and at the end of any suggestions that you have. We're happy to look at those. Thank you.
All right, the Citizens Advisory Committee report. Ms. Newman?
There was a conflict. I was not able to attend the Citizens Advisory Committee this month, and I have a similar problem with next month. The meeting is on the 20th of October. If someone is available to take that meeting in my stead, I would appreciate it. Otherwise, I won't have a report for the next month either.
Sir?
What time?
What time is that CAC meeting?
9:30 to 11 virtually.
All right, I have an idea. For any board member that's interested in attending that or participating and covering for Ms. Newman, please reach out to her. All right? Do that through Boardable or through the Outlook. Okay. There is no SUD Oversight Policy Board meeting, and there won't be again for well, there will be in October, but after we've appointed someone to replace Eric's role as liaison. Okay. Next item on the agenda is our CEO Director's Report. That would be from our CEO, Dana Lazenby. Please, Dana.
Good evening, everybody. I hope you can hear me. I'm sorry, I am having a bad connection, but I think I'm clearer now than I was. I hung up and got back in. But my report is in your packet, so please review it because I'm going to be brief, just to make sure that I give you the most current updates. Just to give some feedback on our reporting and how we report to this board. We are making all efforts to be transparent and to really improve operational efficiencies, to be more operationally efficient. So with that being said, we're looking at our process and how we present contracts to this board to make sure that we're including the information needed so that you can make an informed decision. So I just want to say that up front. The other things that I want to talk about, just real briefly, is I did attend the Sherman conference a couple of weeks ago, and that's Society for Human Resources Management. And with that conference, the focus really was, which was truly interesting, on getting people back to work, but also on their mental health. So the excellent feedback, excellent discussion about how that's best done to keep people safe, physically safe, but mentally healthy and having a balance. The second thing is I'm at the policy conference now in Mackinac, and a lot of the same things are being covered, and that is looking at the workforce issues and how that the pandemic has impacted the workforce. The other thing has to do with children's services, which we know is one of our priorities as well, and how we make sure that we have a true system of care for children. The other thing has to do with economic equity and workforce challenges. So a lot of it is centered on and aligns with the priorities that we have. And I think they're the state's priorities because we've all felt this last 18 months has been very traumatic for many of us and for the community as a whole. Next, I wanted to thank this board for your advocacy efforts. Please continue to use your network and reach out to the governor, the county exec, the board of commissioners, and the Oakland County Sheriff's Office to advocate for the public behavioral health system. We're looking at this legislation and really wanting to make sure that we maintain the public behavioral health system. With that being said, today there was a Senate committee meeting. And it was led by Senator Shirkey. And during that discussion over the bills, the state House bills, or I'm sorry, the state Senate bills, they're 597 and 598. It's really about privatizing the public mental health system and giving it over to the private health plans. So that was the discussion. We actually had an opportunity to give testimony. So the entire leadership team, with the exception of me, because I'm in Mackinac, went to Lansing to be present for that hearing. And our own Chief Clinical Officer, Ms. Kimberly Flowers, provided testimony. And I was able to see some of it before the system went down, but she did a great job. And then with the support of Anya, she was able to answer questions and give clarity to the question about whether or not Oakland Community Health Network as a PHP could actually be a SIP. And the answer is no. So kudos to Kim and Anya for really being there and advocating and the support of the entire team. I have to tell you, we've all worked on this in the last few weeks. Everybody has played a vital part in getting our response together, getting the testimony together that could be impactful and really advocate for the public system. So that's all I have tonight. I would be open to answering any questions that you may have.
Are there any questions from the board virtually?
I just have one, Dana. What was the climate like in the hearing? If maybe Anya could speak to it, I don't know, or other leadership that was there. Did Senator Shirkey seem open to hear what the team had to say? I'm just curious.
Well, I wasn't in the room, but I'll say no based on the feedback that I received, and I'll turn it to Anya and or Kim to give you additional response to that question.
So Kalana and I are both here in the room that were there today. Kalana and I both chuckled when that question was asked, just because Senator Shirkey's response with any opposition was definitely a different response and different body language than when there were people testifying in support of the bills. So, I mean, I want to believe he's hearing people. I'm not sure that that's going to change anything, but his response was definitely not as open and engaging. And in some instances, he even told people to go back and do different research when they would make points about things that the health plans don't cover and different items like that. I don't know, Kalana, if you have anything to add.
No, I would just echo what you're saying. I think that he seemed to be pretty set on what he believes to be the approach to this. So to answer your question, Ms. Newman, I would say no, he's not open. And to Anya's point, or what she stated earlier, is in fact when met with opposition, it was to do more research about what we don't know, which was to me quite disappointing to be on the record when you're proposing legislation that will have a substantial impact not only to the system but to families and persons served and their access to services. And so I felt that there was not enough focus on that from his perspective in introducing this and in his feedback.
So Dana, it's Kim too, if I may. I know we're focusing on what Shirky's response was, but I think there was a better response of some of the other folks on the committee. I think maybe he is set with what he's doing and he has to, listen and hear what people say. But I have to tell you, those testimonies in the room were very powerful today. Many of them were. And I could see some of those other members of the committee nodding and looking over those masks. You can see eyes that were interested in what was being said. So he's one person and he is proposing this. And so I imagine he wants to stand on what he's proposing. However, I would just wonder about what the other people in the room are thinking. So that was my thought about it. Thank you, everybody. That's very informative. Good to know that. Thank you. Mm-hmm.
And I'll just add, Ms. Newman, that I actually have a meeting, or we actually have a meeting with Representative Mary Whiteford next week. So I will get with this board and let you know how that works out as well.
Thank you.
All right, thank you. Next item. Thank you for your comments. Good luck on Mackinac Island. Bring back some fudge.
I will.
Okay.
I will do that.
I can't have it, but thank you. There are others. It's our second opportunity for public comment. Is there anyone?
We do not have any public comments this evening.
All right, they'll have another opportunity at our next session. All right. Last on the agenda are board member comments. Let's go through roll call.
Mr. Collin?
No comments tonight. I am also up here with, except that I'm also up here and did see Dana, and I'm hoping to be able to speak if the legislators get up here to talk to them, particularly in the Senate, so that we can still maintain our public health system.
Thank you.
Dr. Hans?
Yes. There is a lot of discussion about the vaccine mandates in the media, as we all know. The winter months are on horizons, and there is concern in the community about people that we start spending more time indoors, particularly in the vocational settings, where there are many people in the room or in hallway wherever they do their work during the day. And what I'm hearing is that the families are concerned about their loved ones coming in contact with staff who are not vaccinated and breakthrough infections. So I wanted to know what are we doing to encourage or at least strongly encourage people to get vaccinated for their safety as well as for the people that we serve. Do we have a vaccine requirement or anything like that? Or if not, how are we going to address this?
Dr. Hans, this is Dana. Dr. Posios has been actively working with all of our medical directors and chief medical officers throughout our provider network. He's even working with the FQHCs and other entities that we have partnerships with. And he's probably the best one to speak to this, but we are actively planning on ways that we can encourage more people to be vaccinated. We also have a mobile team that is going out upon the request of our SUD providers because we saw the numbers were lower among people receiving substance use treatment. So, Dr. Posios, I know you may want to add something to that comment or question because I know we're actively doing a lot of things. And then with the President Biden's recent order, so that entities more than 100 employees are required to have staff or employees vaccinated. So we're looking at how we implement that order and also looking at ways to encourage people through education and other incentives.
My concern, what I'm hearing is actually specifically from the population of IGD, especially the skill building population that are in, you know, visit not out in the community. And as the weather gets colder, it will be harder for them to spend time a lot of their time will be spent indoors, even when it is kind of reporting to the vocational provider site or whatever. So that is a concern they have, and it's I don't know how it's going to be addressed. Whether it is mandating that I'm sure people who have heard of their employees can mandate vaccination, then that leads to staffing shortages also. Second thing is if there are going to be facilities for weekly testing for these folks who are vaccine resistant or vaccine hesitant. So I think we should maybe thinking about that because it's already starting to get colder. So
Dr. Hahn,
that's
if
the
I may.
concern I'm hearing.
Dr. Hahn, this is Dr. Posios. If I may add to what Ms. Lazenby stated previously, I think, so with regard to the IDD population, fortunately, they are the highest vaccinated amongst those we serve. So that's good. You're correct in recognizing that there are some potential complications from direct care staff being unvaccinated, but those are conversations I assure you are happening at the department level, as we speak, essentially, with regard to how to go about making sure that that staff is vaccinated. So I think there's going to be more to come on this particular issue in short order. I've been in contact with our HR and legal departments about this, and we're really looking to get a little bit more concrete direction with regard to specifics, but I just had a conversation yesterday with HR regarding this very issue. So again, more to come sooner rather than later.
Okay, thank you very much. Thank you for your
Thank you.
Work in addressing this because this is kind of is worrisome to a lot of the families, and that's what I've been hearing in the community. Thank you.
Ms. Newman?
Thank you. I'll be brief. I just want to encourage board members, if it's at all possible, to attend the FACE mental health symposium that we're doing in conjunction with the Committee of 50 and the Oakland County Ministerial Fellowship. I have had a big concern, especially about the children in the city of Pontiac not getting adequate mental health services, which is one reason why I've been excited about us doing this, because it gives it an opportunity for the leaders in the city of Pontiac to meet our providers, to find out what we offer in terms of services, and try to get some clarity as to what we can do to provide better services for our children. So if you are available on the 27th, it's going to be at the Marriott at from 9 to 12, I believe. There's going to be a continental breakfast at 8:30. So I would highly recommend that board members attend, because there's been a big, huge disparity in how children in the Pontiac School District are accessing mental health services. And I would just encourage everyone to be there. Thank you.
This is Vijaya. Malkaya, could you send the link to this event, please?
Yes, I'll send you well, or else Suzanne, can you just send all the board members the flyer with the link to registration, please?
Yeah, we can post it on board goals.
Okay, thank you.
Dr. Tom?
No real comments. See everybody in 2 days.
Ms. Root?
This is a super packed agenda, so thank you all. Like, it's really late, but heartfelt thank you for all this information like you always present to us and for being here.
Mr. Furman?
Once again, I'd like to echo the thanks for all staff members and presenters who presented the information tonight. Those on staff, and especially the representatives from Progressive tonight. It's always affirming to hear those stories, and especially knowing that one of our presenters is going through a momentous occasion tomorrow of getting her own place. That was wonderful to hear. So thanks a lot and have a great night.
Ms. Bernard?
I agree with everything Adam said, and have a good night. Thank you.
Mr. Torres?
No comments. Have a good night.
Mr. Landsman?
I just want to remind people, while we're still in this Open Meetings Act that allows us to be hybrid, please remember to RSVP to Sheila on the meeting if you're going to be in person versus remote. Because for some of these meetings, she does order food. In other ones, she has to make sure the room is set up appropriately. So please remember to provide that notice. As well, when we're on the virtual meetings, please remember to mute. Please remember to raise your hand so we know to call on you. And then last, please contact Sheila about not getting any email from CMHA, and to let her know what your preferred email is. And then as well, if you're planning to attend the fall conference virtually or in person, it's about a month away from now. And then last, just continue to reach out and advocate for the people that we serve. Help them help themselves. That's it for me. If there's no other comments or business to be covered, we are in adjournment.
Have a good night.
Good night, everyone.
Thank you. Good night.
Good night, everyone.